I'm Dr. Maas. I'm a physician at Reproductive Care Center. We're based in Sandy, Utah, as well as Clearfield, Utah. We're part of the Boston IVF network, as well as the EVIA RMA network. Today, we're going to talk about just an introduction to dealing with infertility. And also, I think recurrent pregnancy loss, people kind of lump this together. Separate entities, but both very, very impactful and very stressful. And actually, some of the research and data shows that people with a diagnosis of infertility suffer equal anxiety and depression as people with a diagnosis of cancer or HIV. So let that sit in for just a minute. If you think about your friends, your family members, if someone was diagnosed with cancer, you would be rallying around them. People are wearing their support ribbons. They're out there marching and doing races. But infertility is especially challenging because we have similar aspects of anxiety, depression, and stress. But much of this is faced at home without the support system because there is a component where people, quote unquote, feel like their body has failed them or feel like they're broken. And so they don't always share their journey. I appreciate aspects like Facebook and Instagram and Twitter and getting the word out. But very often, fertility struggles are private struggles that people only share after they've gotten through treatment and achieved their family building. Similarly, multiple miscarriages, very stressful, very anxiety provoking, high levels of depression. And oftentimes people don't share their story until they're well into their journey or their treatment. So as you're looking at doing self-care, think mindfully about who you want to have in your support groups, whether it's friends, whether it's family members. Understand that friends and family members are generally well-intentioned, but often can say hurtful things without meaning to do so. And having a plan about how you're going to approach some of these situations. If you're going to a holiday and you know someone's going to ask you when your family building is going to start, think about a response in advance, or think about pulling family members or friends aside to ask them not to do that in a group setting. So having a plan. If you have a partner, having a safe word or an exit word like, hey, let's go get some milk is, I can't deal with this situation. Let's get out of the room. I need to take time to take care of myself. There's other support networks in Utah. We have Utah Infertility Resource Center. Depending on where you are, Resolve is an amazing resource for people struggling in their family building journey. And then there's lots of community groups, Facebook groups, social media groups. Search online and find your group to help you support yourself. And then this is also a time to be selfish. If you're getting invitations to baby showers, reach out, politely decline if that's too much. Communicate what your needs are with those around you and make sure that you're putting yourself first. This also means taking good care of your physical health in addition to your mental health. And for people that are dealing with stress or anxiety or depression, oftentimes there's an association with disordered eating. That can be eating in excess. That can be restrictive eating. We're trying to control an aspect of our life that we feel otherwise just generally out of control of things. Make sure that you're nourishing yourself. You're eating a well-balanced diet. You are actually eating. And then physical activity is so important for physical health and mental health. There's data that says that exercise can act as well as an antidepressant in a significant portion of the population. So trying to get out, it doesn't have to be running a marathon. If that's your thing, that's fine. But it doesn't have to be running a marathon. It could be going for a walk around the block and doing so alone if you want some alone time, or doing so with your partner to be able to communicate. It's a very nice time where you're unplugged from the rest of the world. You're not looking at your phone. You're not looking at the TV or the computer. You can really focus and communicate with each other. So all in all, most important thing, take care of yourself, communicate your needs, and take care of each other. And the data on that is actually quite muddy. There's some studies that suggest that reduction of stress can be beneficial and help you achieve pregnancy. There are other studies that show that it actually doesn't impact outcomes. I generally think of it as not being a make or break factor. You're not stressing yourself into infertility. You're not stressing yourself into a miscarriage. But general health and well-being is reproductive health. So you want to try to minimize your unhealthy aspects of your life in general. So try to reduce stress, but try to not stress about being stressed. Now, when we get to severe stress, let's say you've lost so much weight, you're not having periods anymore. Now, that type of stress, yes, that can definitely impact reproduction because your body is shutting down. It's going into survival mode. But this is severe levels of stress. If you were alone in a jungle without food, yes, that's going to shut down reproduction. But we can't quantify kind of day-to-day stress and associate that directly. Stress is hard to quantify. There's a bunch of subjective questionnaires that you can take. Mental health providers have these. They can be helpful. The caveat being they're going to vary from day to day, right? Our stress varies from day to day or moment to moment. Just thinking about, popping online, or for many people, going to see the doctor for the first time is stressful. But it's hard to quantify that, and it's stressful to different degrees to different humans. And unfortunately, there's not a good stress metric or calendar or scale, but there are questionnaires that you can use to get a better idea. And these can be done through primary care docs, mental health providers, or counselors. And I would strongly encourage anybody going through their family building journey or their miscarriage journey to engage with these resources. Doing self-care and communicating your needs, again, would be my recommendations. Exercise is important. Some people need medications. And yes, if you don't need medications, please don't take medications. We're trying to minimize exposures in pregnancy, but some people need antidepressants or anti-anxiety medications to be functional, to feel like themselves, to be able to function in a day-to-day world. And so that's not a failure, that's a support to get you through. And there are medications that are safe to try to use when you're trying to conceive or having miscarriages. There are clearly medications that you should not be on if you're trying to conceive, and you would want to communicate that with both a mental health provider as well as your reproductive endocrinologist to make sure that everybody's on the same page. And this circles back to the fact that there's not really solid data, and it goes back to the other question of how do you measure stress? Everybody is stressed going through fertility treatment. It is undeniably a stressful situation. The good news is if stress was the make or break factor, we'd have 0% pregnancies in our fertility treatment. And thankfully, we do get pregnancies. But some data says stress can reduce pregnancy rates. Other data says it can't. Try not to stress about being stressed. It's not the make or break factor. It's something in general. We want you to lower your stress for your general health and well-being. But it is not the thing that's keeping you from becoming pregnant, nor is it the thing that would be causing a miscarriage. This is very common. We know that social media actually is a challenge. It's great because it has things like this where you can get information, but it's also nuanced in the fact that everybody provides kind of a personal perspective or a personal narrative on their social media. And so with social media, some people share their journey and highlight failures. Other people share their journey and highlight successes. And so if you're stressing about this, I would encourage you to pull back a little bit from kind of personal accounts, stick with more infertility specific educational resources, go to your fertility doctors, go to Resolve, and then also try and go to online websites rather than social media for your information. The American Society for Reproductive Medicine, or ASRM, has some really wonderful patient information guides. So I would encourage you to look at that. And then there's some great resources, fertility books and mental health books by PhDs. Dr. Ali Domar is an excellent one, but there's many physicians and PhDs in the field that can speak about the fertility process and the stress of it. So I would encourage you to focus on yourself and your journey because everybody's journey is different. I think there is some benefit to understanding that IVF is not always successful. It's not a guarantee, that it may take more than one treatment cycle. But then there's also stress and frustrations that other people are getting pregnant when you haven't. So it's nuanced. I would say try and narrow your time down. Like, I'm going to spend 30 minutes, 3 days a week looking through this, and set a timer. Give yourself a limit. Try not to just let it take over your life. And I wish you the most success in your family building journey, just sending love and light to each of you. Thank you again. Take care.